Okay, good evening class. Today we're going to do a teach back on 5 important chapters. If you were to prioritize, let's start first with the chapter on blood flow. You probably don't know the reason why, because as we know, the human body has a lot of blood vessels, right? And what is found flowing in the blood vessel? Blood. Very good. Okay. As I already keep on emphasizing in the past, in the study of pathophysiology, which is the study of normal conditions, you have to know what is normal. So let's review in terms of blood flow and blood vessels. What are the two types of blood vessels that you normally see? Arteries and veins, right? Both arteries and veins are blood vessels, and we know for a fact that each of these blood vessels, they have the same wall, right? What do you find in the wall of an artery or a vein? For layers that you have learned in the past. Okay, tunica intima, right? Does anybody remember what is found in the tunica intima? What is found there? Endothelium, very good. What's the next layer after the tunica intima? Tunica what? Media. And does anybody know what is found in the tunica media? What? Smooth muscle. Very good. So smooth muscles. And finally, the last layer, the third outermost layer. What would that be? Okay, adventitia. Some books refer to it also as possibly what? Tunica what? Externa or adventitia. And what is this made of? Anyone? Yes? Okay, elastic connective tissue fibers, which are found in the outermost layer, which happens to be the tunica adventitia, right? Okay. So the difference is that arteries versus the veins, what kind of blood will flow in the arteries? Oxygenated blood, right? On the other hand, what about the veins? What will be flowing in the veins? The oxygenated blood, which means that the blood will contain more what? Carbon dioxide than oxygen. Obviously, in this one, it's more of the oxygenated blood, right? Why? Because the blood came from the lung, right? And the lung went to the left side of the heart and is popped out into the aorta, right? Okay? Now, what is a unique feature that you find in the veins that you do not find in the arteries?
Valves.
Yes?
Valves.
What?
Valves.
Okay, valves, referring to valves, okay. Valves, yes, you are right. They have valves. So the veins have valves. Does anybody know what these valves are for? Prevent what? Prevent backflow. Okay? Prevent what? Very good. Okay? So to give you an example. What condition is it when the problem is in the leg veins and the valves are destroyed and the blood is not able to go up but will backflow into the foot and the leg? What? Who said varicose veins? Of course they're called varicose veins, right? Varicose veins will be the result of malfunctioning valves in the leg. Commonly seen in pregnant women. I'm not saying all pregnant women will develop varicose veins. But what happens? Now remember, these valves in the leg veins are done to prevent what? And to make the blood flow in one direction. Perfect. So you want the blood to flow in one direction towards what? The heart, through the inferior vena cava, right atrium, right ventricle, right? Okay? So apparently in the absence of working valves or normally functioning valves, if these valves are malfunctioning or destroyed, you end up with varicose veins in the leg. Why? Because you cannot prevent backflow. The blood will not flow in one direction, but of course it goes up and down, and most of the time the blood remains in the leg veins. And these leg veins, are they nice to look at? No, they're not. You probably saw the images on your textbook. They're not, especially if you're a model, you're a ramp model, or you're working or joining a beauty contest. It's something that you don't want. Not only that, it can be very painful in many cases, right? Okay, do you understand? Okay, so apparently, when you're dealing with the blood vessels, now what is the blood vessel that connects what do you call the small arteries? Arterioles. What do you call the small veins? Okay, now what connects the two? Very good. Now the capillaries are important. Why are they important? Can anybody tell me why they are important? Where nutrient exchange happens, what else? Oxygen and carbon dioxide. Now let's briefly discuss it, right? If this were an artery, the walls are much thicker because of the thicker walled media. The veins have thinner walls, right? The venules are here. The arterioles are here. Arterioles are small arteries, venules are small veins. So you would expect the blood contains oxygen, and it is transported by the red blood cell. So the red blood cell is like a Krispy Kreme donut that goes into here. And what does it have? Oxygen, because it came from the arteries. Always remember, how will the blood flow? From left to right or right to left?
Left.
Yes? How will the blood flow? From left to right or right to left? From arteries, capillaries, veins, or veins the opposite way?
Arteries.
Why would that be? Remember, how does blood flow? A pressure gradient. You know what the word gradient means?
Yes.
Pressure gradient means pressure differences. Blood will always flow from high pressure to low pressure. Why is the artery have higher pressure? Where did the blood come from if it's an artery? Before the heart. This is the left ventricle, correct?
Yeah.
This is called what? Aorta. Why is this called ascending aorta? It goes up. Why is this called arch of the aorta? It forms an arch. Why is this called descending aorta? Don't you love anatomy? Amazing. You have to fall in love with anatomy to get an A in this class. And if you get an A in this class, 99% you pass the nursing board exam. I'm willing to have my neck cut if you don't pass with the... I'm just joking, but if you fail, my God. The headless professor from West Coast, right? The aorta is known as thoracic because it's in the thoracic cavity. Once it penetrates the diaphragm, it enters the abdominal cavity. It's now known as what? Abdominal aorta, right? The abdominal aorta divides into two, right and left common iliac. The right and left common iliac further divides into what? External and internal iliac, on both sides, right? Okay? So apparently now, the idea here is that why is the blood going to flow from the heart to the aorta? Because who will generate the greatest pressure? Which chamber of the heart? The left ventricular chamber. And if you will observe, when you dissected the pig in the lab, and in UCLA we dissect the human heart, which one is the thickest wall? The left ventricle or the left ventricle?
The left ventricle.
Of course, it's the main pump. The thick wall of the myocardium, when this contracts, called systole, the blood will flow from high pressure to low pressure, from high pressure to low pressure, from high pressure to low pressure. Now, what is the name of the artery to the kidney?
Renal.
Because what does renal mean? What is the name of the artery to the liver? Because what does hepatic mean? Don't you love anatomy? What about on the left kidney? Left renal. What about the spleen? Splenic artery. Now, in each of these organs, are they made of tissues? And are these tissues made up of cells? So let's pretend this is a cell. This is a cell. This is a cell. Cell. So if the blood contains oxygen from the arterial side, carried by the red blood cell, which is the red bus, I would refer to this as red bus, the concentration is higher. What is diffusion glass? Movement of substances from an area of high to low. So this will move from high to low, from high to the cells. Because why do the cells need oxygen? What is the purpose of oxygen for the cell? To generate ATP for oxidative phosphorylation in the mitochondria of the cell. Now, why does a cell need ATP? Because without the ATP, the cell will. In order to produce ATP, do you need oxygen?
Yes.
To maximize the production of oxygen, right? You understand why we need oxygen? You have to be able to explain this in the biomolecular model, okay, level. Now, what do the cells produce that are considered waste?
Carbon dioxide.
So if the oxygen was the first passenger here, now the red blood cell is an empty bus. Who now become the new passenger of this empty bus?
Carbon dioxide.
Carbon dioxide. So carbon dioxide, therefore, because there is more concentration of that in the cell, will move from high towards the red blood cell. Now the red blood cell, therefore, will move from high pressure to low, will now go where? Into the veins. So, for example, the veins will be bringing blood to what? What is the major blood vessel? Like the 405 North Freeway or the 5 North Freeway of veins. It's called what? What is it called? Who said somebody postillo? Okay. It's called what? Okay, so the veins bring the blood via the inferior vena cava, the veins, and then it goes where?
To the right.
Right atrium of the heart. Right? So the blood goes to the kidney via the renal artery, and the veins, called renal veins, this is an example. One organ, one artery, renal artery. One organ, one vein, renal vein. The vein goes to the inferior vena cava, enters the right atrium, passes to the right ventricle through the tricuspid valve, then the pulmonary seminal valve, then to the pulmonary trunk, to the pulmonary arteries, then to the lung, and what happens in the lung? The exchange of gases will take place. You get rid of the carbon dioxide when you exhale, and when you inhale, what do you bring in? And when you bring in oxygen, oxygen now is in the blood vessels. The blood goes back via the pulmonary veins into the left atrium, passing through the mitral valve, left ventricle, aortic valve, then here. Why do you think it's called circulate? What is what is formed? A circle. Does that make sense? Don't you love anatomy and physiology at the same time? Because if you know these things, you will never be L-O-S-T. What is L-O-S-T? You'll always find your direction. What does GPS stand for? What? Global what? Is it GAMO positioning system? I'm just joking, okay? My role here, class, is to guide you. I am your GPS. What is me to guide you? To guide you to go back to what? The foundation of nursing and medicine. What happens to be what? Anatomy. If you know anatomy, then you know physiology. You know anatomy and physiology, you know pathophysiology. You know pathophysiology. When you go to core nursing, oh my God, you'll perfect all the quizzes that they give you. How do I know? I know. I just know. Okay. So, the bottom line here, therefore, is there should always be adequate blood flow so that the cells can get what? The oxygen that they need. Do you understand what I'm trying to say? Now, who's supposed to drain the fluid, excess fluid? What do you call the fluid in between the cells? Very good. The fluid inside the cells, the intravascular fluid, made up of the blood plasma that surrounds the red blood cell. Remember? Okay? The interstitial fluid, or the fluid found in between the cells, who's supposed to drain that? Lymphatic what? Capillaries. Of course. And what will be found in the lymphatic capillaries? Of course, lymph. Don't you love anatomy? What's found inside the blood vessel? What's found inside the lymphatic vessel? And where did the lymphatic vessel come from? Or the lymph in the lymphatic vessel, the lymph were formed from the raw material called what? And where do you think the interstitial fluid come from? From the blood plasma. Because blood plasma, is it mostly water? Is the interstitial fluid mostly water? That's why it's called fluid. Don't you love anatomy and terminology? The water and the fluid will move from here to here, and it's now called interstitial fluid. This fluid is called the plasma volume fluid. From here, and then this will be drained by what? The lymphatic vessels. So now it becomes what? What used to be called plasma, an interstitial fluid, becomes lymph. Do you understand? And this lymph goes back. Remember the right lymphatic vein and the what? Thoracic duct. They bring back the lymph where? Where does it bring back? Huh? Where does it bring back? Where does the lymphatic vein, the right lymphatic vein and the thoracic duct bring the blood? Remember? You don't remember? It brings back to the subclavian vein. Remember if you remember the superior vena cava, right? Superior vena cava is made up of this the superior vena cava that is found on top, and the inferior vena cava. The superior vena cava is made up of what? The subclavian in the veins that come from the head and neck, right? The jugular veins. So essentially, in other words, the lymph will go back to the veins, which means what came from the blood goes back to the blood. Review the anatomy of the veins and the lymphatic vessels. Okay? Now, when you were reading the book, there were certain formula or formulae that I expect you to know regarding blood flow, right? Okay. Does anybody recognize this formula? Q is equal to P over R. And what does Q stand for? Very good. And what about P?
Pressure.
Huh?
Pressure.
Pressure gradient, or delta P, which means gradient or difference. High pressure, low pressure. This way. What about R?
Resistance.
Very good. What is the relationship between flow and resistance? Is it directly directly related or inverse? Inverse. In other words, if you increase the resistance, what happens to the blood flow? And vice versa. On the other hand, what about pressure gradient? What is the relationship? Direct or inverse?
Direct.
In other words, the greater the pressure gradient, what happens to the blood flow? Because it's direct. In other words, the higher pressure difference between these two, the faster the blood will flow, the greater blood flow will occur. Do you understand? Now, let's define resistance. In your book, there is a formula. R is equal to 8NL over pi R to the fourth. And what is the name of this formula or law? Anyone? Anybody who knows? Huh? What's the name of the law? Poiseuille's law. Okay, is that French? These telemarketers, they keep on calling me. Poiseuille's law. How do you spell Poiseuille's? Perfect. You're the woman that might pass this question in the quiz, right? Poiseuille. And what does R represent? This one here. And what about N? Viscosity. What about L? Length of the blood vessel. What about R? And what is pi? We were 3.14, right? R is what? Radius. If you look at this in terms of radius, what is from here to this? It's called what? Diameter. What is half of diameter? Perfect. In other words, is this something very important for us in the field of medicine and nursing? Yes. To be able to explain that is happening in your body? I'll tell you why. Radius. What is the relationship between radius and resistance? Inverse. In other words, if you increase the radius, what happens to the resistance? Huh? Decrease resistance. And if you decrease resistance, what happens to the blood flow? Huh?
Increase.
Increase or decrease? Of course, it's obvious. I brought it up. It has to increase. Can anybody know the definition of the word resistance? What? Huh?
Opposing force.
Okay. Who said opposing forces? These two women are prepared for this quiz, I can tell. They're copying answers from each other. I'm just kidding. They probably read the book 3 times. How many times did you read the book?
0.
Huh? How many times? Or you didn't even bother to read the book? Because I gave you a study guide. Okay. If I were in your shoes, if I would go back to school, I would read the book 100 times. I have to find time. I would wake up at 4 in the morning just to study. My goal is to be number 1 for myself. I don't care about you people. I care about myself. I want to pay those student loans. See? I want to have a better future for my children and buy 5 houses in Vegas. Put up my own hospital. I can only do that if I get the license, and that means I have to be number 1 in my class for myself, right? You understand what I'm saying? Why you need to study? Did you notice that did I have any books here? Did I have anything in front of me? No, because you have to do what I told you to do. Remember, buy a whiteboard and do what I do, if possible, right? Okay. Now, resistance, according to what's your name, my dear? The young lady who said, what is it?
Pardon?
What did you say about resistance? The definition?
Opposing force.
Okay. So, in other words, if this was the blood vessel like this, the blood was supposed to flow this way, right? What is opposing? Anything that will what? Opposing force means prevent it from flowing this way. Right? Will radius be one of them?
Yes.
Yes. Why? If this will become smaller, will that decrease what? Radius? What happens to the resistance? Higher. On the other hand, when this becomes bigger, what happens to the radius? Higher. And what happens to the resistance? Huh? Lower. And if you lower resistance, what happens to the blood flow? The blood flow will increase. So can I combine these two formula into one called the gamma formula? No, I'm just joking. There is no such thing. But can I do that? Q is equal to P delta over R, where R is this, right? So I can change this to what? 8NL, right? You understand what I'm saying? So this represents the R. Does that make sense to you guys? Now, the bottom line therefore is, I can answer anything you ask me. Because I know the formula. I'll give you an example. In the heart, what is the name of the artery to the heart? Huh? How many do we have? And what are they? Left and right. Don't you love anatomy? Amazingly simple, right? And what does the coronary artery carry with them? Oxygenated blood or deoxygenated blood? So the oxygen is needed by every myocardial cell or myocardial tissue. What happens when you have fat deposits there? What is the term called in your book? It says what? Athero what? Sclerosis is hardening of the arteries because of the deposition of fat. What do you call those fat deposits there? Very good. The flag of recognition that you're going to die. Flag. So when there is presence of fat deposit there, class, what happens? What happens to the radius? It decreases. And what happens to the resistance? It goes up. And if resistance goes up, what happens to the blood flow? It goes down. Don't you love anatomy and physics combined? Who loves physics here? And math? I love math and physics. You should. Because everything we do has to do with math and physics. When you give medications to your patient, you have to do dosage calculations. Can you afford to be stupid in the math and dumb? No. Every time you make a mistake in the calculation, the patient could rest in 6 feet under the farmer wrestling in that forest. I'm not kidding. When you do the dosage calculations, it's one of my favorite topic. When you give drugs to your patient, make sure you do not make a mistake. Overdosage, kill. Underdosage, kill. It has to be perfect, accurate. Okay, so what is the term used when there is decreased blood flow? Ischemia. That's the reason why when these people have is fat deposit, it leads to what? Decreased blood flow to the myocardium. Will there be chest pain?
Yeah.
And what is the term used? Angina, chest pain, pectoris means pectoral region. So if I go to the hospital having chest pain, what do you think am I suffering from? Is it, am I right away? You know what I means? Infarction. The cells are not dead yet, right? What do you have here? Myocardial infarction or myocardial ischemia? Are we supposed to use proper terminology here? So what am I suffering? I go to the emergency room. Nurse, I have... So what is it? Ischemia. Is that the reason why it's called ischemic heart disease? Atherosclerotic heart disease? Or coronary artery disease? Do they mean the same thing? What is the pathology that's common? Fat deposit where? Coronary. Which part of the artery did they deposit? Tunica intima or tunica intima? They do deposit in the tunica intima. Isn't that amazing? Because of the deposition here, it has an effect on the rages, effect on resistance, effect on blood flow. The moment there is decreased blood flow, otherwise known as ischemia, it's called myocardial ischemia, and that leads to chest pain or angina. Now, Dr. Gama will prescribe a drug called nitroglycerin. This drug could be either given under the tongue or in the form of medication skin patch or orally. It's probably take a longer time. What does this drug do? You have like, what do you have under your tongue? Veins. Huh? So veins in the tongue, superior vena cava, goes here, to the lung, back to the lung, back here, and then what? To the coronary arteries. It travels. Does the veins jump from here to the heart? It's through the blood vessels. I hope you understand that. And people don't understand that, then you must not be nursing. So if I put the medicine under the tongue, because there are what? Blood vessels, particularly what? Capillaries. Go there, this direction. See? Tongue, goes here, then goes where? Back to the coronary arteries. Do you understand? Now, what does this drug do called nitroglycerin? It's a vasodilator, very good. So what will it do to the smooth muscles here? Dilate or contract? Dilate or relax? You know, okay, this is something I always emphasize in anatomy. What is found in the tunica media? Smooth muscles. What can muscles do? Contract and? So when they contract, you have vaso what? Or vasospasm, muscle spasm. When they relax, you have what? Does it make sense? Therefore, will these drugs cause the smooth muscles in the tunica media to relax? Nitroglycerin? Could be. And when they relax, what happens? You have vaso what? And when you vasodilate, what happens to the rages? It goes up. And when the rages increases, what happens to resistance? And when resistance goes down, what happens to the blood flow? So will vasodilation by giving nitroglycerin relieve the chest pain?
Yes.
Is that the reason why these drugs are called anti-anginal drugs?
Yes.
What am I trying to drive at? There is nothing that you cannot answer in this class, as long as you know what you're doing and you have the right knowledge that is found here, not in the cell phone. You understand? So by giving nitroglycerin, it's a coronary artery vasodilator. It will make the smooth muscles relax, thereby increasing what? The rages. Increase rages, decrease resistance, increase blood flow. Patient is happy. The chest pain is relieved. But what should the nurse watch out for? When you have vasodilation, what will be the effect on blood pressure? Now remember, when you give the drug under the tongue, can that drug travel all throughout to the 405, 409, 5 south, 91 east, 91 east freeway called blood vessels? In other words, The drugs that you are going to give will not only have an effect on the coronary arteries, but also what? Peripheral blood vessels and arteries. Can they also vasodilate? So if you have a patient with angina being given vasodilators in the form of nitroglycerin, what should the patient's nurse watch out for? Huh? And what is the definition of hypertension? For example, before you give any drug, you get the baseline blood pressure of your patient. The blood pressure was 125/80. After 30 minutes, the blood pressure went down to 90/60 after giving nitroglycerin. Is that something bad? Are you supposed to call Dr. Gamo? Dr. Gamo, we gave this drug at 7 in the evening because of chest pain, angina. Originally, the patient's blood pressure and blood pressure was at 125/80. After 10 minutes or 5 minutes, it went down to 90/60. What could I do? Either stop the medication or lower the dose. Lower the dose first and then observe again. What you want is to relieve chest pain, but you do not want them to develop hypertension. Do you understand? Okay? Is that clear, class? So we combine two formulas here, right? This and that. Is that clear?
Yes.
Now, since we're already talking about atherosclerosis, can this affect every artery of the body? Right? Look at my tummy. What is this? He says what? What? Because I do not exercise. I have a sedentary lifestyle. Could I be prone to heart disease?
Yes.
Instead of using the elevator, instead of using the stairs, I use what? I'm a lazy man. I want to die.
No, you have alone. You have to die.
You just want me to finish the class, right? After 9 weeks, you want me to die. Okay, it's okay. I'm just joking. So the bottom line, therefore, is, where do you think my excess fat will go? Exactly. I already talked about the signature assignment last week, right? There's one question there about what? Why do you think it was covering about the cholesterol level, the high-density lipoproteins and low-density lipoproteins, right? So you were supposed to discuss the normal and abnormal levels. Every time you have high levels of lipid, hyperlipidemia. Hyper means high, lipid, fat, emia means blood. You will be at risk of developing what? Ischemic heart disease, coronary artery, otherwise known as coronary artery disease, or what? Atherosclerotic artery disease, right? You understand, class? Why? Because there is the common pathology of fat deposition in the wall called plaque. You understand? Now, let's talk about atherosclerosis. There was one mention about what is Berger's disease. Have you heard about Berger's disease? Although I did not put that in study guide. This is commonly seen among young men who what? How many of you smoke here? Well, go ahead, continue smoking. So after 1 month, you can amputate your foot or hand. I'm just joking. But it's really true. It's also known as thromboangiitis obliterans. Why is it called obliterans? Because the blood will become obliterated, and your distal portions of your fingers and your foot becomes what? Gangrenous. And what is gangrene? When there is no more blood flow, what's the color of that portion of the? It becomes black. Gangrene, no more blood. From blue becoming black. That's worse. And what do we have to do? Amputate. I'm not saying all of you who smoke will develop that, but some of you will. If you do, call me, take a selfie and say, hey, Dr. Gama, you're right. I should have listened to you. I should have stopped smoking. Now I have to suffer. No, I'm just joking, of course. Okay. Berger's disease, B-U-E-R-G-E-R disease, or otherwise known as thromboangiitis obliterans. Now, in the veins, what is it called when you have a vein that is inflamed? It's called what? What's another word for vein? Phlebo. If it's inflamed, it's called phlebitis. Now, what do you mean by thrombophlebitis? Yes? Thrombus means what? Stationary what? Clot. So in other words, if there were leg veins here, right? Leg veins to the inferior vena cava. The leg veins, most of them are called saphenous veins, right? The leg veins here have a clot attached to the wall, and it becomes inflamed. What are the cardinal signs of inflammation? Number 1, rubor, redness. Number 2, calor, warmth. What is dolor? Pain. What is tumor? Swelling, increase in size. So when a patient comes to you and says, "Nurse, I have leg pain," what should you do first? Assess, examine the leg. Try to find out, oh, when you look at the leg, it's red. By ocular inspection, by inspection or with the use of the eye, you can see that it is what? Swollen, there's increased size, tumor. And when you palpate with your hands or fingers, it is warm. And there is pain or dolor. Could that be thrombophlebitis? Now what causes this? Not moving. In other words, many of these patients in the nursing home, they are depressed, they are sad, they don't like to work, stand, exercise. They just want to lie down and wait to die. My son and my daughter is not visiting me. I'm so depressed, I just want to die. They don't love me anymore. Even if the nurse wants to let them stand or walk, they don't want to cooperate. That happens. They develop thrombophlebitis. So this could have been prevented if you just make them stand and walk. How can you do that? You have to what? Use your persuasive ability as a nurse. To become a nurse, it's not an easy task. It's difficult. You have to be a comedian. You have to be a nice person. Hi, good morning, ma'am. How are you today? Come on, let's dance the boogie. If you're the nurse associate, good morning, ma'am. My name is. You will never become an effective nurse.
No.
If this were Yelp, the comments would always be, crazy nurse. Not so nice nurse. Needs to be fired. You think that you have to be a good nurse. Huh? Don't be rude to your patients. Some of you are really rude to me. How much more to the patient, right? And you'll be fired in the first week. Believe me, I can really tell who can be fired. If you don't change your behavior in front of patients. Hi, good morning. You know. So, let them stand, let them walk. But the moment they don't cooperate, they don't stand, they don't walk, they develop thrombophlebitis. Can you exercise that leg?
No.
What?
No.
Who says no? Who says yes? Who says yes? Okay, why would you exercise the leg? Why will you not exercise the leg with the clot there? Yes, anyone? Yes? Huh?
The clot moved to the lungs.
I can tell you're still studying, huh? Why will it move to the lung? Why?
Travel to the lungs is not the effect.
Give me, if this were a GPS, tell me the directions. If you make a right turn at the right saphenous vein, make a left turn into the inferior vein, give me that direction. Let's start with the left saphenous vein. So from a small vein to a bigger vein, femoral vein, that goes where? Inferior vena cava, then goes where? So what is happening here is that the thrombus is no longer a thrombus, but has become a traveling what? And what do you call a traveling clot, class? So, does it stop in the inferior vena cava? Why not? It's big, exactly. Have you ever wondered why? How come I keep on asking why, how, where, and when? Because that is how you become smart. What is the recipe of becoming smart? Ask questions. And what is becoming smart? Answering your own questions. Why did it not stop there? Because the vena cava is big diameter. Why did it not stop in the right atrium? It's a big chamber. Why did it not stop in the right ventricle? It's a big chamber also. My God, same answer. Will it stop in the pulmonary trunk? No. Why? Because it's a big trunk. Now, why did it stop in the lung? What is found in the lung? And what is the name of that capillary in the lung? And what does pulmonary mean? Oh my God! Amazing! The blood clot had no choice. The blood said, "Oh my God, I'm trapped." Have you ever heard the blood clot talking to itself? Have you ever seen those policemen apprehending the criminal? The police car and the blood clot. all those spikes and everything, but once the clot reaches the pulmonary capillaries, what can pass through a capillary? How many red blood cells can go through a capillary?
One.
Can you imagine that? So by the time it reaches the lung, we have the same setup here, right? We have pulmonary capillaries in the lung. By the time the clot reaches the lung, OMG, the clot will just say, hands up, no more, nothing I can do. I'll get stuck here forever. Is that called pulmonary embolism? How would you know, therefore, that the patient has pulmonary embolism? She or he will complain of what? What does SOB mean? It's not son of a bitch, right? This is what? Why are you laughing? Joke only. I apologize for the people on the... It's called shortness of what? Otherwise known as dyspnea, difficulty of breathing. D-Y-S-P-N-E-A, where dys means difficult, nya means breathing. So a patient, aside from dyspnea or SOB, what would they also experience? Huh? Bam! When you become future nurses, and I am your patient there, I am 80 years old, and I suddenly complain of chest pain with difficulty of breathing because it is possible that the clot traveled from my leg veins to my lung. And how would you know? Because when you examine my leg, it has evidence of pulmonary embolism as a result of thrombophlebitis. Can I die of thrombophlebitis and pulmonary embolism?
Yes.
Is that a life-threatening condition?
Yes.
Will this topic come out in nursing board exam?
Yes.
Now, what's the difference between deep vein thrombosis and thrombophlebitis, which usually affect the deep veins? Which usually affect the deep vein thrombosis or thrombophlebitis? Oh my God! Don't you like medicine and nursing? Unlike can thrombophlebitis affect the deep? Definitely, because it's still a vein. But most of the time, if you have redness and warmth, it could be more of the superficial veins. But it can also happen to have the deep vein. But in deep vein thrombosis, most of the time there is no inflammation. It's just purely what? Possibly just a clot. Now, why did this clot develop in deep vein thrombosis? I'll give you another example. Dr. Gamo, before he came to the United States, was in the Philippines. And I would go home to the Philippines from time to time. The plane ride from here to the Philippines is how many hours? 13, 15 hours. I'm inside the plane, and I'm sitting on the plane. I'm not standing. I'm sitting there for 15 hours. Immobilization, can that predispose me to the development of DVT? If there's a clot forming there and I start walking to the carousel, get my bag, can I develop pulmonary embolism there too? Sudden onset of chest pain with difficulty of breathing, DVT. So what do they recommend that when you are in the plane and you're planning to travel, like me, I'm going to Europe in a couple of months to visit the Queen in London? Remember? I'm just joking. I go there. What should I tell my kids and my wife because we're traveling together? Get up and walk. Meet men and women. Hi, my name is Dr. Gama. I'm running for president of the Dr. Gama's fans club. I thought I'm going to run for president of the United States. No, I can never become president because I was not born here. I was born in Kenya. Okay, if you didn't get the joke, it's okay. Okay. So I would go up. I would pretend that I am making wee-wee, even though I don't. I go to the restroom. There's nobody there. I just go there and walk back. I go back to the restroom again and go back. But what is my intention? To prevent me from developing DVT so that I will still be alive 9 weeks from now for your final exam. You understand? Or sometimes you can do this. You understand? Walk around, do exercise, okay? Is that clear? Okay? Now, so when it comes to these conditions here, you have to be aware that there are many drugs that we give, right? Now, what is the definition of a drug that's called anticoagulant, exemplified by heparin and warfarin, or otherwise known as Coumadin? Yes? No. So they're anti-coagulant. Coagulate means to clot. Coagulation. Clotting. Anticoagulants such as heparin and warfarin, otherwise known as Coumadin, they can only prevent further clot formation On the other hand, what does a thrombolytic drug do? Breaks down. Lytic means to break down. Dissolve the clot. Thrombos, clot. Stationary clot. Lytic means to break down. So remember, there's a difference between the two. Example of these are your what? Streptokinase, urokinase, abokinase, gamokinase. I'm just joking again. Is antiplase. Does it make sense? So is there a difference between thrombolytic drugs and anticoagulant drugs? Yes, there is. Anticoagulant drugs will never dissolve the clot, only the thrombolytic drugs. But these thrombolytic drugs are only effective within a certain period of time. You have chest pain? Now what's the difference? I forgot to mention this, although this will be a topic next week or next week. When does it become an MI? First, myocardial ischemia. These are the other names, right? It is when what? When the blood clot is what? Getting bigger? Oh no, I'm sorry. There's the fat deposit here. What happens to the blood flow? Not only will it be decreased, but what else? You form a clot. And where does the clot go? In between the fat deposit is a blood clot. What will the fat deposit and the blood clot do? Completely block the flow of blood. No blood flow, no oxygen. What do you have now? Myocardial infarction. Infarction means necrosis. Necrosis means tissue death. Why is there tissue death? Because zero what? Zero what? Zero what? Zero what? Zero life. Death. What is that? The myocardial cells. What kind of necrosis would that be? Is that fat necrosis coagulative?
Coagulative.
Because what does coagulate mean? Oh my God. Amazing. Okay? So if I were to give a thrombolytic drug, should I give it within the first 3 to 4 hours? If you have anybody with chest pain, should you wait for tomorrow?
No.
A lot of people do that. Oh, honey, don't bring me now, just bring me tomorrow. And then when they wake up, they're all dead. The chest pain person. Stiff rigor mortis. So anybody with chest pain, be it your father, your mother, your grandmother, grandfather, your boyfriend, girlfriend, do not ignore, bring to the emergency room. In fact, the best time or the best thing, what do you tell the nurse to become admitted in the hospital? No. Just tell them chest pain, because if you tell them I have a heart attack, they might not believe you, so you might not. Well, if you say a heart attack, it's okay, but now if you're planning to do that, make sure it's authentic, you know. I have chest pain. Why are you here, sir? I have chest pain. In the mind of the nurse, is he crazy? I just want to have a nice place to stay tonight. Free board and lodging, covered by medical insurance. Now I'm just joking. Don't ever do that, okay? We need all the hospital beds for the people who are really sick. There's what we call malingering. People pretend that they are sick, but they are not. Okay, what else? So when you have an MI, that's different from an ischemia, right? In MI, it's already dead. In ischemia, it's just, remember the hydropic swelling I mentioned to you? Hydropic swelling, lack of oxygen. MMI, it's no longer reversible, it is what? Irreversible, because the muscle cells are dead. And when the muscle cells are dead in the heart, can you also be dead?
Yes.
Almost. You go into cardiac arrest. That will be a topic next time. Okay? Is that clear? So, let me see if I want to go into the study guide. So, they talked about thrombophlebitis, deep vein thrombosis. Now, what's an aneurysm, class? An aneurysm, if this were an artery, is an abnormal what? Ballooning of the wall, whereby the wall becomes what? Thinner or thinner?
Thinner.
And when the blood pressure gets higher and higher, this becomes bigger and bigger. Can it burst or rupture?
Yes.
Now, what do you call the arteries in the brain?
Cerebral.
Because what does cerebral mean? So this is found in the brain, it's cerebral arteries. Can this rupture?
Yes.
A ruptured aneurysm? How do you know that you have a possible aneurysm? Because you have recurrent what? Now what do most doctors tell you when you have headaches? You have what? They have what? When you have a headache, what does it tell you? Especially if it's recurrent. It begins with letter M. I would strongly suggest if you have recurrent headaches, don't just go to any stupid doctor. Go to a headache specialist. These are usually neurologists. And what do neurologists do? They study the brain. They might even recommend a CT scan or MRI scan with angiogram, with a dye. Because that's the only way that you can see the presence of what? Without the dye. Remember the word dye? The white dye or radio, opaque. Opaque means white. Inject, and then they can see the dye will flow everywhere. White, 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 white. If you have an aortic aneurysm here in the abdominal aorta, it's going to be like this. White, 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 white. White, 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 white. Because it's in the blood. What is in the blood? The dye. And what's the color of the dye?
White.
It's called opaque, means white, radio opaque. Does that make sense? You have to do a CT scan with angiogram or MRI scan with angiogram, which means insert injecting a dye. And most of these dyes are what? Be careful because they have an allergy, they can develop bronchospasm. So it's, especially with regard to the dye, right? Iodine-based dye. You have allergy to shellfish, don't give the dye. Okay? Anyway, don't worry, we'll learn that in the nursing board exam review. Okay, what else? So we talked about an aneurysm. This is the most common cause of death. Remember, you know Bruno Mars? His mother died of this, a rupture of aneurysm. It's Filipina. She died at a young age, at 57, just like my age. Oh my God! And we talked about Berger's disease, atherosclerosis, embolus, thrombus, resistant blood pressure. Now, there is another formula which is probably too premature, but I want to share it with you. What is BP? Cardiac output times SVR. Cardiac output is the amount of blood, this will be a topic next week, but I wanted you to realize what's important. Is the amount of blood pumped by the heart per minute equals heart rate times what? Stroke volume. What's the difference between that? Cardiac output is the amount of blood pumped by the heart per minute. Stroke volume is the amount of blood pumped by the heart per beat. What is the meaning of these? If you increase the heart rate, what happens to the cardiac output? It goes up. On the other hand, if you increase your cardiac output, what happens to your blood pressure? It also goes up. Now this SVR, systemic vascular resistance, refers to these. Resistance. Now where is our resistance? This one. Increased resistance, increased blood pressure, because the relationship is direct. Increased cardiac output, increased blood pressure. Increased resistance, increased blood pressure. For example, when you have what? Fat deposits there. Increased resistance, it's harder for the blood pressure, the blood pressure will definitely go up. Increased resistance, you end up with what? Increased blood pressure. You understand? Okay? Now, with regard to the chapter on oxygen transport, as we have said, oxygen is transported by what cell? The red blood cell, otherwise known as erythrocyte, correct? Okay. Erythrocyte or red blood cell carries what? Oxygen and carbon dioxide, correct? Now, question now is, if you look at that red blood cell, it has 2 alpha and 2 beta what? Chains of hemoglobin, right? And in each chain has a porphyrin ring, which is what? What is the porphyrin ring there? Hemoglobin, heme. Globin refers to the globulin, which is the 2 alpha and 2 beta globulin rings, chains. The heme, which contains the porphyrin ring, is the one that contains what? The iron, right? Okay. In order, therefore, to produce red blood cells, you need iron. And because of these, what is the most common form of anemia? Perfect. Iron deficiency anemia. As we also know, the red blood cells are formed where? In where? Which bone marrow? Red or red?
Red.
Is it yellow or red?
Red.
Yellow fat. Red bone marrow, red blood cells, white blood cells, and platelets, correct? So the platelet and red cells and white cells are produced in the bone marrow of the bone, right? Now, therefore, how long will the How many days for the red blood cell to survive in this world? 120 days. So what happens? On the 119th day, imagine me to be with a red blood cell. I'm about to die. I shall need to go to my final resting place. Where is the final resting place of these red blood cells? They go to the spleen langia. Spleen langia. Oh my God, I can see the spleen in the left upper quadrant. Upon reaching the spleen, 120 days, they die. Now what happens in the spleen? What happens to the dead, sexy Buddha? Okay, there's no more time. I will answer my own question. They will be recycled. It's a recycling plant. Okay, you, dying cell, go ahead. Bam, you die. I will get you some iron. And where do I bring the iron? Back to the red bone marrow so that I can use that iron again for future generations of new red blood cells that are younger and sexier and prettier. A pretty red blood cell. No, I'm just joking, of course. In the red bone marrow, correct? If the spleen is overloaded with dying cells, the liver can be there too, right? Okay? So, the idea therefore is that when you're dealing with these kinds of conditions, you have to realize that other forms of anemia would be what? What? Is polycythemia a form of anemia?
No.
It's actually the opposite, my dear, remember? Anemia is a decrease in the red blood cell count. Polycythemia is increase, right?
Anaplastic.
Huh?
Aplastic.
Anaplastic or aplastic? Okay, what's the difference between iron deficiency and aplastic anemia? Iron deficiency, you lack iron, especially among pregnant women, right? Why do you have the less iron? Because you are competing with the baby. What do we give the woman? Ferrous sulfate, which is ferrous, ferric is iron in chemistry, correct? Fe, ferric, ferrous. You understand?
Yes.
On the other hand, in aplastic anemia, it's because of exposure to certain what? Chemicals, like insecticides. When I was a young medical student, we are very aware of these things. We tell people, be careful, whatever insecticide you use, watch out. Because this can help make you develop aplastic anemia. What happens in aplastic anemia? There is what? What will be affected? Okay, so if you affect and destroy the bone marrow, what happens to your red blood cell count? What happens to the white blood cell count? It's called what? Hmm? So if it's decreased red blood cell, anemia. What about if it's decreased white blood cell? Leukopenia. What about decreased platelet count? Thrombocytopenia. And if these three are low, it's called what? Perfect. It's called pancytopenia. Does that make sense? So why is it that there is pancytopenia in patients with aplastic anemia? Because whatever the triggering factor, which happens to be usually an insecticide or chemical, destroyed what? And therefore, if you destroy the red bone marrow, the red blood cell goes down, anemia. White blood cell goes down, it's called leukopenia, and of course, you end up with thrombocytopenia. But in the three of them combined, it's called pancytopenia. Can we do a bone marrow transplant for these patients?
Yes.
You understand? What about patients with chronic kidney disease, CKD, or uremia and end-stage renal disease? Why do they develop anemia? What is lacking? Very good. And what organ produces the erythropoietin? And what does erythropoietin do? It stimulates the red bone marrow to produce more what? Red blood cells. In other words, if your kidney is failing, in other words, you will not be able to produce erythropoietin, you will not be able to stimulate the red bone marrow to produce what? Red blood cells. So what therefore do we give a patient with chronic kidney disease as a form of treatment? Man-made or synthetic form of erythropoietin, correct? Epoietin alpha. Right. What's another name for that? How many for LVNs here? Somebody say something? Procreate, yes, you are correct. Are you an LVN? Have you ever given Procreate to your patients or synthetic form of erythropoietin? You understand what I'm saying? Don't you love anatomy, medicine, physiology, and nursing and medicine? What is lacking, we give them. In the form of synthetic form of erythropoietin. And that's how people become billionaires. They use their intelligence to become a manufacturer. They get it from China, the raw material, and we repackage it. Gamopoietin. As simple as that. Or if they don't want China, then they go to India. These are two magic, believe me. I have studied all these things. Either India or Pakistan or China. Raw materials. Me, I get my products from Mexico. It's good. I'm in trouble. You have any questions yet so far? Right. So apparently you have forms of anemia. Treatment very easy depending on what kind of anemia you're dealing with. Right. Oh, hemolytic disease of the newborn. What does it mean? Have you ever heard about this?
Yeah.
If you were my student in anatomy probably, or physiology, I've talked about this before. Another name for hemolytic disease of the newborn is called erythroblastosis fetalis, right? And apparently, what happens here is that you have what? Female, male. Female, of course, the mother. Male, father. It has to do with the word RH, which means what? Rhesus. Antigen. What's another name for these? D. Antigen. Not everybody has this. Like for example, I am blood type B. Positive. What does the positive mean? I am RH positive. I am unique. I'm not the ordinary person in this world. I am related to the rhesus monkey. If you see me go like this, whoa, 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 that's me. I have my cousins, they're called rhesus monkeys. So these are people who are fortunate enough to have that positivity. How many of you are RH positive here? Because we might be related too. Who else? Who else? You are okay, we are related, the 3 or 4 of us. Even though you're Armenian or Russian, whatever your nationality is, but we are related by blood, see? I'm just joking, of course. We are not related at all. Unless your last name is Gamo, then you must be related to me. But if not, you are not related. I am not your father. Okay. The problem is this. Mother is RH negative. Father is RH positive. Of course, they have sex. Mother gets pregnant. First baby. Got the father's genes, becomes RH positive. Do we have a problem here? No. Yes, we do. Why? Because they're not compatible. Remember, the baby is going to stay for 9 months for free in the uterine cavity. And what prevents the mixing is the placenta, right? So during what? Placental separation. Remember this thing? When a woman is pregnant during labor, vagina here, go. Thank God I am the first baby. I will not die. Why will the first baby not die? Because in the first pregnancy, the separation of the placenta occurs once the baby is out. Baby out, the umbilical cord lengthens. And how do you know that placenta is separating? Because it is sudden gush of warm blood, right? And lengthening of the umbilical cord, that will come into the nursing board exam. Lengthening of the umbilical cord, it means the placenta is separating. That's the reason why the cord is getting longer. And the sudden gush of warm blood means it's being separated from the endometrium of the uterine wall. The problem now is that when you separate the placenta from the uterine endometrial wall, will there be mixing of mother's blood and baby's blood?
Yes.
Mix mother's blood and first baby's blood. But the good news is that the first baby is already out, crying, and they're smiling, I'm alive. Who will suffer? Why would the second baby suffer? Because once you mix the mother's blood with the baby's blood, it's like Star Wars. Interceptors, immediate launch. Interceptors, immediate launch. Enemy approaching. Enemy approaching. Interceptors release antibodies. Antibodies are formed. Antibodies will be formed. Are now in the blood. Second baby again is RH positive. Don't blame the father. He just contributed to the sperm formation. RH positive second baby. Is there a problem here?
Yes.
Big problem. Because during pregnancy, whether we like it or not, even though we praise the placenta, but still the blood could mix inadvertently. And what will the antibodies do? Attack the red blood cells of what? Of the baby. And the red blood cell will burst. It's called hemolysis. Red blood cell lysis means breakdown. So hemolytic disease of the newborn is when the newborn is born, jaundice and dying. It's also known as erythroblastosis fetalis. Does that make sense?
Yeah.
So what can we do for these mothers? We can inject them with what? What is Rogam?
It's a synthetic.
Synthetic form of what? Antibodies. Rho means RH, Gam means gamma globulin. I'm just joking. Gamma globulin, synthetic by the Gamma Industries, formed by the manufacturing company. Okay. When do you inject this? If I'm not mistaken, I cannot remember my obstetrics. During the 27th month of pregnancy and during labor, two injections. Why do you want to do that? Because by giving the Rogam here, you're trying to what? Preempt. By giving the Rogam here, the mother will not what? When do you give the Rogam? 27th month of pregnancy and during labor and delivery. By doing so, you do not let the mother form his own what? We do not form antibodies by the mother because you gave what? It's like a form of what? Passive what? Immunization. By giving the Rogam or the antibodies to the mother will not form his active antibody, which is destructive. This will kill. This will not kill. What lesson else do you learn from here? How many of you here know your blood type? How many of you do not know your blood type? Why are you in nursing school? Isn't it obvious? You should know your blood type. How many of you are blood type B here? Okay, I better get your phone numbers because I'm blood type B. If I meet an accident on the freeway, I will call you. Even though I'm bleeding, I'm having hypovolemic shock. Hi, this is your number, my dear. What's your name? Ariana Grande. I need your blood. I'm dying. Are you willing to give your blood to me? Just to get an A in this class, right? Okay. I'll give you an A in heaven if I don't survive. I will fax it to you. Oriana, for donating your blood to me, even though I'm dead, you get an A in heaven. Okay, now, what's the moral lesson here? Very simple. Let's pretend, this is just a joke, by the way. You're a man and a woman, you wanted to have sex with your partner, you go to the motel, you're about to remove your underwear, and then you remember, oh my God, I remember Dr. Gamma said to me, I need to ask my partner, honey, are you RH positive or negative? What if the partner would say, I do not know, okay, abort. You wait for the proper time. There's always a time for everything. A time to have sex and not to have sex. Today is not to have sex. Because why? You don't even know your blood type and your RH positivity. Honey, the lab is already closed. It's already 11 at night. The first thing tomorrow morning at 7. Once you find out, you can have sex at 7:05. You're laughing, it's true.
Story.
It's just true. Before you have sex with anyone, especially if you don't know the blood type. Remember I said, how many of you in your blood type RH you don't even know? You don't even know your blood type, how much about the RH? Now can you imagine? Some women or families, the reason why they only have one child is because of this. Have you ever wondered? The second baby is aborted, spontaneous abortion, because the baby dies inside the uterine womb, fetal death in utero. Who killed the baby? The antibodies of the mother. I'm not saying the mother is a killer. You murder a mother? I'm just joking. Apologies to all the mothers. I love my mother. My mother is dead. I'm just joking, of course. You don't think you murdered. Can you imagine the emotional trauma that your baby died inside your mother's womb? I can just imagine. I've never been pregnant at all, but all the guilt feelings that you have. What did I do wrong? Why did I have sex with this man which is RH? Now, by the way, I'm RH positive. Don't blame me. I just gave the sperm. You understand? But there is hope. Giving Rogam. You understand? Somebody said, is it not routine to do the examination? Sometimes they do, but what if they forget? It's okay to have one child. Less expense. I'm just joking, of course. We have a choice. You have a choice to have a program, right? Okay? You understand, class? Okay. Now, talk about leukemia. Which among the leukemias is most commonly seen among children? Acute lymphoblastic leukemia. Which one has the Philadelphia factor? Okay, chronic myeloid CML, very good, right? So, in leukemia, the problem is that you have high levels of the white blood cell count, but these white blood cells are what? Defective. They're destroyed, so they're useless. That's why, what's the most common cause of death among these patients? They die of what? Infection. Because even though the white blood cell count is normal, abnormally high, but they're not able to protect you because they're cancer. Imagine. So CML, the Philadelphia chromosome, but of course acute lymphoblastic leukemia, commonly seen in children. Now in multiple myeloma, what's the problem here? The bones are usually affected, right? And of course multiple myeloma affects the bone marrow. What happens is that, what is it that we measure in their urine? What is it?
Ben Jones protein.
I can tell this young lady is prepared for the quiz. How do you spell Ben Jones?
B-E-N-C-C.
And then?
J-O-N.
Jones, Ben Jones protein. Very good. Very good. So be aware of that, right? Okay. Now, in terms of hypersensitivity patterns, we talked about this before, or at least part of it. Before we have the quiz, let's review this very quickly. You have what? Type what? 1, 2, 3, and?
4.
Okay. Type 1, 2, 3, 4. So hyper what? Okay. So type 2, type 3, type 4. Which one involved the T cell?
Type 4.
Which involved the B cell?
1, 2, 3.
B, 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 B. Now, what do the B cells develop? Immunoglobulin or antibodies, right? So what is the immunoglobulin here?
IgE.
What about here?
IgG.
And what about here? Okay. Here is the T cell. Right? There is therefore no importance of the what? The antibodies or immunoglobulins. What about complement activation? Remember the complement system? Where is it activated? Complement? Complement? Go look at the table. There's a table in your book. Complement? Complement? Yes?
The complement.
There's a table there in the book. It's a table similar to this. What table is that? What page? Complement? Complement? Not here, not there, right? Okay, what else? What's another name for type 1?
Immediate.
So allergy, what else? Immediate? Right? What's another one for type 2? Tissue sensitive, cytolytic, cytotoxic. What about type 3? Immune what? Complex disease. And type E would be delayed what? In other words, when does this occur? The occurrence occurs in how many minutes?
15 to 30.
15 to 30 minutes. 15 to 30 minutes. What about this one?
10 days to 2 weeks.
First and third one, immune complex. Look at your table. Don't you have a book? Don't you have a book with you? Huh? Huh? Look at your book. Book. Is it the first chapter 10? Go. Okay. Open the book. Open your book on this page. There's a page there. Come on. Is it there? Book. I'm not talking about notebook. Book. Don't tell me nobody brought the book. Nobody brought the book. Oh my goodness. There you go. There's a book. She gets extra points in heaven. Chapter 10, my dear, I believe.
6 hours.
So how many hours? 6 to 8?
6.
6 hours.
6 or more.
6 hours. What about this one? Is it 24 to 48 hours of days? Huh?
48 to 7. 24 to 48.
Oh my God. You understand what I'm saying? Minutes, the reaction. So what are the examples of their type 1? You have what? Allergy. What else? Rhinitis, right? With IgE. Do you involve mast cells here too? Mast cells releases histamine, right? And then of course allergy, rhinitis, what else? Anaphylaxis, anaphylactic shock, what else? B. Sting, right?
Yeah.
Of course you have hives,
Oh, yeah.
right? Allergy, asthma patients. What about type 2? This is where you have your what?
Transfusion.
ABO, blood transfusion, BT problem, blood transfusion, what else? Hemolytic disease of the newborn, right?
Yeah.
Newborn, and then finally you have what?
The grave.
Myasthenia? What else?
Graves.
Thyroiditis or Graves' disease. And then what? Oh, Graves' disease, right? And then thyroiditis. What about immune complex, number type 3? Okay, post-streptococcal what? Glomerulonephritis. What does it mean? You have a streptococcal throat infection. After 1 week, your urine becomes red. You develop what? Glomerulonephritis due to what? Antibody production. Again, the streptococcus sore throat, damaging the glomerulus. You end up with hematuria. What else? SLE. What is SLE? Lupus erythematosus. I would say my mom died of SLE. It's probably the worst kind of what? She died at the age of 42. Systemic lupus. It attacks all the cells of your body. The brain, skin, lungs, blood, everything is destroyed. You have pancytopenia. That's the worst kind. Okay, what about here? Remember? Tuberculin what? Reaction, remember?
Yeah.
When you check for the purified protein derivative testing for TB, it takes, when is the earliest time you want them to come back? 48 hours. And you would expect the lesion to be what? 10 millimeter or more and elevated and what? Indurated, elevated, okay? What is the other example there?
Contact.
Contact dermatitis, what else?
Stevens bomb.
What else?
Pustular psoriasis.
Psoriasis, what else? Did they mention about myasthenia gravis and
That's type.
did they mention about MS and the bottom line therefore is this is also one way of studying, coming up with a table or a map like this. The idea here therefore is that this is a very important topic. Do you understand, class? Okay. Okay, that's it. I will now